much for joining us for the February ERM Toolbox webinar. A couple of housekeeping notes. If you've dialed in by phone and haven't logged in by computer and you'd like to see the slides and the video that will be shown, please point your web browser to readytalk.com. In the box where it says Participant Join a Meeting, enter the same access code that you used for the call, 9879821. On the next screen that appears, you just scroll down to the bottom of the webinar invitation, enter your name and email address, and click Register for this call, and you will be placed into the webinar. Let's see, please stay aware of the level of background noise in your area. We are leaving the phone lines open. So if it becomes noisy, please put your phone on mute. If your phone doesn't have a mute button, you can use the ReadyTalk controls to do so, which are *6 to mute and *7 to unmute. If you're called away from their phone, please do not put the phone on hold because that will cause your hold music to be transmitted to everybody else. If you need to leave the call, you can simply hang up, dial back in when you're available again, and it will not disrupt the call. As I said, we're leaving the phone lines open, so you can ask questions as they come up. We also have the chat box available if you would prefer to ask questions that way. You can type a question there, and I will relay it to our presenters at an appropriate moment. As I mentioned, we will be showing a brief video during the webinar, and although the audio for the audio portion of the call is coming through your telephone, the sound for the video will come through your computer speakers. So just letting you know that in case you need to unmute your computer at that point or anything like that. With that, let me introduce our speakers today.
Dr. Emily, yes? Emily, before you do that, do we press *6 to mute and then?
*6 will mute your line, and then if you want to say something, you can press *7 and it will unmute it.
Okay, great, thanks.
So our presenters today are Dr. Jessica Drew-DePaz and Dr. Don Maurer. Dr. Drew-DePaz is a clinical psychologist with a background in mindfulness meditation who spent nearly a decade overseeing training at UC Irvine's Environmental Health and Safety Department. These two seemingly disparate positions led her to realize the potential benefits of infusing psychology into safety. She is now the Mindfulness and Safety Research Coordinator at UC Irvine EH&S. In collaboration with UCI's Susan Samueli Center for Integrative Medicine, she's investigating the impact of mindfulness on employee injuries, errors, attention, stress, well-being, and job retention, as well as organizational costs. Dr. Don Maurer is an instructor for the Mindful Health and Safety Program at UC Irvine and a board-certified physician with 30 years of experience in emergency medicine. He has a long-time interest in stress reduction, meditation, and mindfulness, and has taken professional training with Dr. Jon Kabat-Zinn and other senior faculty at the Center for Mindfulness in Medicine, Healthcare, and Society at the University of Massachusetts Medical Center. He teaches mindfulness-based stress reduction and other courses in mindfulness through the Susan Samueli Center of Integrative Medicine at UCI. In addition, he is a consultant in the development of a research project at UCI being led by Dr. Drew-DePaz, investigating the effects of mindfulness in the workplace. So, Jessica and Don, I will hand the controls over to you.
Great. Thank you so much, Emily, for the introduction. And thanks to all the participants for being here today. And I also want to thank Don, my co-presenter, who is also my mindfulness instructor. So I'm clicking on the next slide, Emily, although it's not clicking. Okay, there we go. So today, Don and I will be talking about the UC Mindful Health and Safety Research, an innovative approach to injury reduction, if we do say so ourselves. Let's see. Looks like there's a little delay when I click on the slide here. So our agenda for this conference call is to first talk about UC Irvine injuries and their root causes, and then we'll get into stress and mind wandering, their role in illness and injury, as well as the fact that mindfulness can be an antidote to stress and mind wandering. We'll do an overview of some of the mindfulness research and then get more specifically into the research that we are conducting. Okay, so a bit of background on myself is, as Emily mentioned, I've kind of worn two hats for a while. I'm a clinical psychologist with a background in mindfulness, but about a decade ago I accepted a position at UC Irvine Environmental Health and Safety, where I oversaw the health and safety training offered to our campus. So, just two very different roles. But at a staff meeting a few years ago, we were taking a look at some new injury investigation metrics at UC Irvine. We were asking questions in a new way about why people thought they got injured, what they felt that the root cause might be. And as you can see by the pie charts here of our top 4 injuries, the number one reason people felt that they got injured is that they were inattentive or distracted. And this is in, many of the cases over 70% of the time. So as I sat with that information, I was really struck by the fact that such a large percentage of subjects were talking about being inattentive or distracted, but yet it occurred to me that in the trainings that we offer, we're not addressing the issue of attention. In the 60 safety trainings currently offered at UCI EH&S, they're really largely technical in nature. And, we teach people to extinguish fires and drive motorized carts, but we rarely address the issue of attention. At most, in some of our classes, we have a slide instructing people to pay attention, maybe while working with a laser, but telling them to pay attention and teaching them how to do so are two very different things. And to sort of show an example of this, I thought I would use this opportunity. You're all in a webinar right now, and I could tell you all to pay attention right now to our talk. But instead, we'd like to take you through a very brief sort of coming into the moment exercise. And I know we're not all in the same room, but I'd like to ask you to just do this in your office, because really we can bring ourselves into the moment with our senses, no matter where we are. And often our bodies arrive places long before our minds do. So you may be sitting in a chair or standing and on the phone, but your mind may be very busy thinking about perhaps a meeting you just came from or what you need to do later on today. And so let's use our senses to be the gateway into the present moment. I'd like to ask you to just look around and notice your surroundings. Just take in what you see. And now shift your attention to your sense of hearing. Notice the sounds that are around you, perhaps in your office or maybe even farther beyond. And now bring your attention to your body and how it feels to be maybe sitting in your seat or standing. Notice where you're making contact with the chair or the floor. And now just bring your attention to your breath. And notice your breath as you inhale and as you exhale. And I thank you for using your senses to bring yourself even more fully to this talk. And we'll do a more in-depth exercise a bit later, which I'll have Don lead. I'm going to hand it over to him right now.
Hi, this is Don Maurer here, and my experience in the emergency room for 30 years has led me to question the role of stress, health, and illness, and performance, and even what the effects this has immediately on people. Because if you think about stress, you might kind of come to the conclusion that I have, that it's not so much the stress itself, but how we respond to it that makes a difference in our lives, in our health, and our performance. If we look at has anyone ever seen anyone who looks in this condition responding to an email, a request, a project? Stress is part of our response to stress can be part of a fight or flight response, fight, flee, faint, or freeze, as you may have heard it, which has evolved over millions of years in our nervous systems to give us an instantaneous response to threatening conditions. In the ancestral environment, this was, of course, very important, avoiding predators, avoiding being eaten so that we could enjoy our next meal ourselves. And in a stressful modern times, the fight or flight response, which stimulates alertness, the sympathetic nervous system, everything comes immediately online. Muscles tighten to respond immediately to a threatening position, all very adaptable, all very relevant to our survival. But in the modern environment, whereas in the ancestral environment, say if you were a zebra, there's an interesting book written called Why Zebras Don't Get Ulcers by the doctor at Stanford named Robert Sapolsky, who said, you know, the fight or flight response was very adaptable in that environment where the threat came immediately and was usually over with immediately, and you could return immediately to grazing, chilling, your blood pressure came down, the respiratory rate came down, everything came back down to immediate baseline condition, whereas in the modern environment, human beings oftentimes carry the stress chronically. The email, the conversation, what would have happened if I had gotten in that accident continues to play out because our minds are kind of virtual scenario simulators, and we're thinking about the past, how things might have been different, or the future, how we're going to handle problems, and the stress response continues, causing elevated adrenaline, cortisol, and so forth, which can lead to chronic illness, various kinds, chronic pain, headaches, stomach aches, cardiovascular disease. Since the beginning of the last century, the stress response has been investigated, and the causal kind of relationships between stress and end organ disease, whether it's heart disease, lung disease, kidney disease, nervous system disease, gastrointestinal disease, has been well established. The other part of this interesting virtual simulator that we call our minds, playing out various scenarios, is that besides the mind responding to potential threats, the mind wanders. And we'll talk about how mind wandering and stress sometimes go together. Perhaps you may know some individual like this whose mind seems to be in different places than what they're actually doing at the time. And some of this can be pleasurable, and some of it can actually be stressful, even though the actual circumstances of what the individual is doing at the moment might actually be considered pleasant. Research was done recently analyzing almost 3,000 people's response, being called up anytime, day or night, to ask what they were doing and where their minds were, and it turns out that about 50% of the time in our waking hours, our minds are actually wandering, doing something other than the activity we are physically engaged in. And the interesting thing about this is that this is oftentimes actually can be a stressful fantasy or scenario that we're playing out. We may not even be aware of it. And more interestingly, that people who were actually engaged mentally, their minds were actually on what they were doing, were reported that on average they were happier than people who were fantasizing, even if it were pleasant fantasies. So individuals who were doing whatever they were doing, whether it was even unpleasant tasks, reported on average that they were happier if they were focused and paying attention to what they were doing than if their minds were wandering. So, as Jessica mentioned, this brings up the role of, well, what does this ability of our minds to be engaged in some other scenario than what we're actually doing at the moment have to do with injuries and accidents? Because, as Jessica said, most people report that the reason they're having accidents because they were distracted or their minds were wandering. So the question that we're raising in the research is, how is it possible that training the attention and actually working with this facility that we call working memory capacity to bring the mind to be more engaged in this moment, in mind-body connection, so that training of attention, which is what we'll explore in mindfulness and meditation, actually has a carryover benefit in routine daily activities of being able to actually focus and pay attention much more frequently than you would otherwise normally. So the question is raised by William James, the father of psychology, over a century ago, was how do we actually train the attention? And as the quote here says, the faculty of voluntarily bringing back a wandering attention over and over again is the very root of judgment, character, and will. And as we will look at a little further, he might have said also performance. And education, which should improve this faculty, would be the education par excellence, but it is easier to define this ideal than to give practical directions for bringing it about. And what we'd like you to consider is that a tradition that is actually thousands of years old and has been brought in under scientific investigation within the last 30 to 35 years, called meditation and mindfulness, actually offers this training of attention program that William James could only fantasize about.
So now we'll get into the mindfulness programs that are offered and how they are an antidote to stress and mind wandering. So Dr. Jon Kabat-Zinn is largely credited with bringing mindfulness into mainstream Western culture. In 1979, he worked as a professor of medicine at the University of Massachusetts Medical Center, and he was deeply concerned with the full catastrophe that so many people are living as they face their own stress and pain and illness. And by the way, he was aware that this wasn't only in patients, but also in the employees who were providing care. And as a student of meditation, he believed that the practices that he was learning could be beneficial to everyone. He recognized that Buddhist meditation was far from mainstream, and so he developed a secular program entitled Mindfulness-Based Stress Reduction in hopes of alleviating suffering. And today there are many mindfulness-based interventions used throughout Western culture, but MBSR, the Mindfulness-Based Stress Reduction, continues to be the most widely used and widely studied. So I wanted to first, before we get into MBSR a bit more, I wanted to share Jon Kabat-Zinn's definition of mindfulness. So he defines it as paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. And we're going to play a video clip now of him actually elaborating on this definition for a minute or so. And so if you don't have your speakers on your computer, please turn those on so that you can hear this next clip.
my working definition of mindfulness is that it's the awareness that arises through paying attention on purpose in the present moment and non-judgmentally. So it's awareness, and the awareness is cultivated by paying attention. And in a particular way, on purpose, in other words, intentionally, in the present moment, which is the only moment we ever have to be alive in. And then, most challenging of all, non-judgmentally. And that means, of course, we have judgments about everything, but to not be caught in those judgments so that we color everything through our likes and dislikes. So that sounds pretty simple. Okay, paying attention, I can do that. But actually, when you start to pay attention to how much we pay attention, a lot of the time our minds are all over the place, and we have a very hard time sustaining attention. And our attention is not very vivid, and it's not very stable. And teachers go out of their minds screaming and yelling at their classes of students, pay attention, pay attention, pay attention. But nobody learns to pay attention by being screamed at to pay attention. So, but it's something that we can teach to people how to pay attention. And it's very, very powerful to learn how to sustain attention moment by moment by moment by moment by moment.
Great. So the course that Jon Kabat-Zinn developed in 1979, the MBSR program, the standard format for it is it's an 8-week course that meets for 2 hours a week with 1 6-hour silent retreat. It's a supportive group where the participants are basically developing their own mindfulness practice. They're learning things such as a body scan or yoga-based movement or sitting and walking meditations. At this point, more than 20,000 people have completed the MBSR training at University of Massachusetts, and many others have completed their professional training to become MBSR teachers, which has resulted in the program being offered worldwide. And it's also offered in a variety of workplaces. Just to name a few, the Federal Trade Commission, different professional sports teams, including the Seattle Seahawks, who recently won the Super Bowl. They have talked about using mindful meditation, and the military, and many businesses and law schools. And some of you may have seen recently, Time Magazine did a cover story on the mindful revolution happening in our country. As Don mentioned, mindfulness has been practiced for thousands of years around the world, but it's really kind of taking hold in the United States over the past 40 years since Jon Kabat-Zinn introduced the secular program, and we began to study it and find evidence for many, many benefits that this brings to people, which we'll be getting into. But for now, we wanted to give you another little taste of a mindfulness exercise, a very brief one. Don will lead us in a breathing exercise.
So I invite you to consider that this thing we're calling mindfulness is always accessible, always present, just as close as this breath. And to simply take a moment, sitting comfortably, relaxed, and bring your attention to your breathing. You don't have to change your breathing in any way. You don't have to count it. Simply coming in tune with the breath coming and going in your body. Perhaps noticing where you feel the breath most vividly. Perhaps with the air coming in at the nostrils or the mouth. or the sensation of the breath moving in the chest or abdomen, the slight rise of the chest or abdomen. You might even like to put your hand on your belly. Feel the slight sensation moving in and out. Just noticing the breath. And as you're doing this, you might also notice that the mind wanders, that the attention has gone to some project, some conversation, something that's going to happen in the future or might have happened in the past. And just noticing this tendency of the mind to wander, perhaps naming, labeling, mind wandering, thinking, planning, or boredom, or restlessness, whatever it might be. And bringing your attention back to your breathing. Just being with the breathing, as if you were tasting the breathing, surfing the breath, the direct, sensory, visceral connection with your breath. And as we prepare to end this brief period of formal meditation, being aware that this ability to come into the present moment is always as close as this breath and this breath.
Thank you, Don. Are there any, did anyone have any questions or want to share about their experience going through that brief meditation?
Hello, this is Katie Pickard. Can you hear me?
Yes.
What I noticed was that it was hard for me to relax when I started thinking about my breath, and then when I began, as we got deeper into it, I realized, oh, I'm starting to relax. Mm-hmm. So I think that my first sensation was a sense of tenseness.
Mm-hmm. Mm-hmm. Right, and that's oftentimes the very first awareness of the mind-body connection that happens, that, oh, I'm not relaxed, or I feel an area of tension or tightness, or, oh, some people even report that it's difficult to connect to the breath because when they begin thinking about it, it is anxiety-provoking. So whatever your experience is your experience. And that's the thing about the meditation as an experience, is that you begin to see both the mind-body connection and your present moment experience, and also become aware of how the mind kind of wanders and pulls you away from that into various concerns that it might have, if that makes sense.
Oh, yes, it does.
Great. Thank you, Katie. Did anyone else want to share? Okay, so we'll move on, and I think when I took my own mindfulness class with Don, I think there many people in the class, we might come in with the expectation that it might immediately be relaxing or stress-reducing. But there are, I think, what we discovered is more that mindfulness is really an opportunity for us to learn how untrained our minds truly are. And that in a way they're a bit like a puppy. A puppy has a mind of its own, and so do our minds. And so this exercise helps us to learn how to bring it back over and over, and without judgment. Part of the definition is non-judgmentally. And so even finding the ability not to judge ourselves while we're practicing mindfulness when our minds do go off, that's normal and human, and it happens to all of us. Yeah.
And the other thing about your question is that it's true that meditation is oftentimes relaxing, and in fact the course is called stress reduction. But in fact it may not be relaxing, especially at the beginning, and the discovering how much our mind wanders or how much tension it is actually may paradoxically seem to be stress-provoking in the beginning. But it's like a skill, like learning to strengthen a muscle. Like in the beginning, it may seem boring, repetitious. The muscle may be sore, and you may think, this is not strengthening my muscle. This hurts, and it doesn't feel good. But in fact, it's actually bringing attention to an area that hasn't been used or exercised, and as with time and with repetition, the muscle begins to strengthen, and you become more comfortable with the practice, and it actually begins to both feel good and strengthen itself in the process.
So in summary, mindfulness meditation, it's really about retraining your attention, becoming aware when your mind is wandering, knowing where your attention has gone to, being aware of this, letting go of distractions, and having a kind, open, curious attitude to your present moment experience, whatever it is. And this next slide is one of my favorite pictures. I don't know who did this, but I love it. Mindful or mindful. And I just wanted to sort of open it up to see what do you notice when you look at this picture. Does anyone want to share what they see going on?
Well, I see, this is Katie again, I see one person is actually in the moment, and the other one is everywhere else. Exactly, which I certainly relate to the person on the left, that often there's just, and I would imagine many of us do. I think we're leading such fast-paced, busy lives. Our minds are filled with, all the things going on and all the things we have to do. But, often we're actually missing the present moment experience that the person on the right is having. And, just kind of a question to put out there for everyone to think about, and a question that's on our minds is, which person in this scenario would be more likely to get injured? And, of course, the kind of the hypothesis driving this research is that if we can get employees more into a state more like the person on the right, that we think that is going to reduce injuries for them. And I will pass it back over to Don to do an overview of the mindfulness research.
So this is all very interesting theory, but the question is there any practical benefit to meditation and mindfulness in the, quote, real world? And it turns out that there's a lot of both research going on in this area at leading medical centers and scientific centers around this country and around the world, which goes along with the fact that mindfulness and the Mindfulness-Based Stress Reduction course is offered in leading medical centers and institutions in this country and around the world. So because of the evidence-based, proven success that this program has had in benefits for a wide range of both physical and mental illnesses. So starting in the early 80s with Jon Kabat-Zinn's first research paper coming out of the Stress Reduction Clinic at the University of Massachusetts Medical School, the growth in meditation and mindfulness research has grown exponentially over the last 35 years. And the research findings show consistent and predictable benefits in a wide range of physical and mental illnesses, in addition to improving performance and health in, quote, normal populations and workplace populations, where there's been significant findings of benefits for the immune response, sleep, overall well-being, in addition to those other areas where it's been looked at in, quote, disease states, where it has reduced chronic pain, headaches, high blood pressure, stress, anxiety, and depression, among many other areas where it's been studied. So the basic science behind this has grown exponentially also in the last 10 to 15 years, particularly in the area called neuroscience. And in that area where you might have heard the term neuroplasticity, that essentially says that neurons that fire together, wire together. So that the meditation is actually proven to show up, the effects of meditation to show up in brain scans, functional MRIs, PET scans, in areas of the brain associated with memory, sense of self, empathy, and in other areas where it's been looked at in the areas of the attention and the frontal cortices during meditation, the attentional areas, the executive control areas where the mind actually directs attention and decisions, shows increased blood flow and growth among meditators. And this can be has been shown to happen within not only a single period of meditation where there's increased blood flow, but within a short period of meditation, less than even 8 weeks of the MBSR course, where there's measurable growth in areas associated with the attention, executive control, memory, and so forth. So looking again a little further into the practical benefits of how does this help in the workplace? Well, beginning with a recent study that came out of the University of California, Santa Barbara, students who took a brief mindfulness meditation program for just a couple of weeks showed improvements in working memory capacity. And as you know, that working memory capacity is what holds both the attention together but connects the attention with the experience in those areas of the brain that have to do with what is relevant to the task at hand. So that working memory capacity. So improving working memory capacity, and shown in terms of performance and improving grades of students who took the mindfulness course versus a control group in the graduate record exam performance. Such studies and such benefits have convinced the Army that this is a useful program, and a neuroscientist named Amishi Jha and a member of the military named Elizabeth Stanley at Georgetown University developed a program based on mindfulness-based stress reduction to train recruits going into battle. And their work has shown that this mindfulness program not only improves, quote, in the laboratory, in the test, working memory capacity, but performance in battlefield conditions, in extremely stressful conditions. And the hope, and this is under study now, is that this allows a better decision-making process, a better response to stress, and reduced incidence of PTSD in active combat veterans. So then, bringing us back to the question of our research here, and what might this training have to do with safety and decreased injury and accidents? We don't really know, because it hasn't been studied very much. There's 1 or 2 studies out there on people who are distracted while driving, and obviously they do have more accidents and injuries. That's only stands to reason. But it hasn't been really looked at proactively if the attention and mindfulness is actually trained and enhanced. Would that actually lead to decreases in accidents and injuries and enhanced performance?
So essentially, you know, when you look at all the studies, you sort of get the feeling that we should be keeping mindfulness within reach of everyone. It's a great pill to swallow. Now we're going to move into the UC Mindful Health and Safety research, and you know, essentially what we've been doing here and what we're going to be doing as well. So, as mentioned, you know, earlier, it was a while ago when looking at these stats that I had this idea that we should be, you know, really infusing mindfulness into the world of safety. I want to give kudos to my boss, Mark Gomez, because, you know, at the time he was director of environmental health and safety. Now he's an assistant vice chancellor on this campus. But when I mentioned the idea to him, he completely embraced it and has been totally behind this. And this wouldn't be happening if it weren't for his support. So what we did was we put together a proposal and shared with UCOP Risk Services, and I want to thank them as well. We shared what is happening in the world of mindfulness and what the research is showing and why we think this could help employee safety records, and essentially express that we would like to explore the potential for mindfulness to improve health and safety records in the workplace. So I'm going to just very briefly go through the steps that we've been going through in order to just lay the foundation to conduct this research. And the first has been to build a collaborative research team. So, you know, here at UC Irvine Environmental Health and Safety, we're working closely with UCOP, as well as the research is being conducted in collaboration with UCI's Susan Samueli Center for Integrative Medicine. They offer mindfulness classes to the public there, which is where Dawn teaches, and they also conduct research there. And Dr. John Longhurst has taken me under his wing to, you know, really oversee the research portion of this and make sure that it's solid research that we're doing here. And that's been a great relationship. We're also working with the UCI Medical Center because we're gearing up to run this with nurses there. And we've been in conversations with other UCs about possibly bringing this to other locations. And another thing we had to do was take the mindfulness-based stress reduction protocol and adapt it to sort of infuse some safety into it. I mean, really, MBSR is the foundation of this course, but there are some themes related to safety that we've woven in to have that be a part of the focus. And we also needed to obtain IRB approval in order to run human subjects research, and we are IRB approved to run it. And we've been working on applying for funding to different places. It looks like our funding for the upcoming study will actually come from Be Smart About Safety funding. And once we have that pilot data, we need that in order to apply for NIH grants. So that's what we'll be doing in the future once we get the initial pilot data. And we really had to look at the data at UC Irvine and where we wanted to put our energy. And we decided we needed a large population with and a group that had a large number of injuries. And so we decided to focus on nurses at UCI Medical Center. And you know, Dawn went over the research. I thought I'd mention some of the weaknesses that are noted in the research is that sometimes mindfulness is compared to, you know, nothing or compared to maybe a wait list. And it's really more solid research when you randomly assign the people, the research participants, and half of them go into a mindfulness group, and then half of them go into, say, a health education program. And that's what we are doing. So the nurses that enroll in this, and they would be getting 22 continuing education units, they would either be in the mindfulness program or a health education program that has no mindfulness, so that we have something to compare it to. Because if they only do the mindfulness, you wonder, well, was it being in a group for 8 weeks? Is that what caused the change? Or was it the mindfulness? And when you have the active control, you can really, sort out those answers better. And then another piece is having that we've incorporated objective outcome measures, and I'll get into that in a bit. Basically, our hypothesis is that compared to the active control group, those in the mindfulness-based program will demonstrate reduced work-related injuries. For the nurses, we're also going to be looking at their medication errors, so reduced medication errors, which would reduce organizational costs. We believe we'd find reduced stress levels and reduced sick days. And we would also be looking at increasing attention, productivity, job retention, and quality of life. So we have measures for all of these. I think the one I'm most excited about is we're actually doing computerized attention measures. So we'll have hard data on their attention and how it affects them. And we actually did a kind of informal pilot also recently. Dawn taught the Mindful Health and Safety program to our environmental health and safety department and some facilities management managers. It was optional, so approximately 20 people enrolled, and we decided to do an abbreviated protocol. So it was a 12-hour versus a 22-hour course, because the MBSR is a 22-hour course. And so they met 1 hour a week for 9 weeks with a 3-hour retreat. And they had homework where they would have audio meditations that they listened to at home to incorporate that into their life. And we also got IRB approval to basically get practice running the research measures. And we looked at some of the preliminary survey results. We needed to get the hard attention measures, the computerized attention measures. We had some computer glitches and worked through those. And so we don't have like pre and post attention measures for this group. But we do have their survey measures, and we found significant improvement in 3 out of the 4 of the surveys. So we found that their mindful attention awareness scale, that their mindful attention went up, and that their stress in 2 different scales went down. And one survey, the satisfaction with life survey, we didn't see a significant change, although we're also researching, looking more into perhaps replacing that with a different measure of quality of life. And here we have a bit of participant feedback. Maybe Dawn and I can go back and forth on reading this, but one person said, I have a lot of things going on, lots of input, lots of stressors. Now I think I really should be paying attention to the road and the red light and the person walking.
Another person said, what I've realized about myself is this rush to hurriedness underlying what I do, including washing the dishes. I even time myself doing the dishes stressed and doing it taking my time, and it was the same time. It's like, wow, there is this stress that I'm creating that's not even real. And in my experience with mindfulness personally, and with so many of the students who've been through the course, is that this course can fundamentally change one's relationship to time and to this hurry sickness that we all have. And coming into realization that this moment is the only moment that we have to live, to grow, to really do anything, it actually changes your relationship to time, and it can actually expand time in the sense that this is what I'm doing now, this is where my life is now, and this is kind of the underlying approach of the research also. This is what I'm doing now, this is what I'm paying attention to.
Great, and 2 more comments. One person said, for me, the practical application is how I respond to work things. Typically when I get an email, I want to respond right away. Now I check in with myself about my goals, and I ask myself if this is urgent. I now have the awareness to focus on what I need to get done. I'm not at the beck and call of everyone's requests. Okay, and then we're going to skip the last one just to leave a bit of time for questions. But, you know, the final slide here is just talking about the future, and that we're basically positioned right now to begin our pilot with UCI Medical Center nurses. In the future, at some point, we want to begin experimenting with the protocol more in the research, you know, seeing, well, can we offer shorter, if we have the results we want with the nurses, we also want to know, can we have the same results with a shorter protocol? What about blended learning and putting some of this online or all of it online for certain populations? And this is not just for nurses. You know, we're really looking at this as, can this, you know, reduce injuries, reduce stress, increase attention and productivity and quality of life for essentially all employee groups. So we're excited to put this into practice with many different groups and to see what we find. So we wanted to open it up for questions, comments, input. We'd love to hear from you.
The phone lines are open, so if you have any questions, feel free to ask them. And if nobody has any questions at the moment, I'm sure Jessica and Dawn would be happy to answer any that you have later via email. I'll be sending out a follow-up to give folks their contact information.
Right, and we are also in process of building a public website with information related to this. And, you know, I think that Emily will be following up with an email. If any of you are interested in being notified when our website is complete, then please respond to her email. It would be a response to me, and I would notify you by email once our website is up and running.
And with that, we are coming up on the top of the hour. So let me once again thank you both, Jessica, Dawn. This was wonderful. And thank you, everybody, for joining us. We hope to see you again for future ERM Toolbox webinars.